Hello, I'm going to tell you a little bit about the PREVENT project, and the acronym stands for the Prevention of Bloodborne Viruses through Education, Clinical Networks, Testing and Treatment. The project is actually focusing on 3 bloodborne viruses, so it's hepatitis C, hepatitis B and HIV, and the project is focusing exclusively on people who have substance misuse problems. So we talked a little bit about this already, but just to sort of refresh our thinking, why are bloodborne viruses important in substance misusing populations? Well, the prevalence in my clinic is very interesting listening to Natasha's piece about mathematical modelling, because in my clinic I have a hepatitis B rate of about 50%, a hepatitis C rate of about 70%, and an HIV rate of 3%. And that may be determined by the fact I have a central London clinic. But I don't know really, it was interesting to think how that might play into some of the mathematical modelling that we heard about. Obviously we've talked a lot already about the individual health needs for someone who has hepatitis C or the other bloodborne viruses. But also we've touched on the public health issues in terms of onward transmission. They're treatable, as we've heard, and they're also preventable. And one thing perhaps we haven't talked about so much yet is the economic analysis that you can do in terms of, I suppose at the most extreme, it's the cost of perhaps a hepatitis B vaccine versus the cost of a liver transplant. Now, substance misusing populations are generally vulnerable, marginalised, stigmatised, and difficult to engage in treatment. They have poor knowledge of the risks of infection, and a statistic that always shocks me is that 50% of substance misusers infected with hep C and 30% with HIV are entirely unaware of their infections. Now that clearly has a huge impact both in terms of their individual health and the risk of onward transmission. And as we saw from an earlier slide, we're seeing an increase in bloodborne virus infections in injecting populations, unfortunately, over the last couple of years. That's particularly HIV, but we're seeing it in hepatitis as well. So this project, the PREVENT project, was funded by an organisation called the Health Foundation, and it was part of a project they were doing called Closing the Gap. And what Closing the Gap projects were meant to do, they were meant to close the gap between current practice and evidence-based practice. So we're meant to bring those two together. And as we've already seen, there's a very well-developed evidence base for the clinical management of bloodborne viruses. And as we've seen from within my service, there's variable practice. Some things we do well, some things we don't do very well. But there is very clearly a gap. So the project is a 2-year project. It's just started in April this year, and I'm going to tell you a little bit more about it now. The geography of the project is most of northwest London. It's a very big patch, population of about 2 million people. Within that patch there are 15 addiction clinics run by my trust, 9 major hospitals, the largest specialist centre for HIV treatment in Europe, which is at the Chelsea and Westminster Hospital, a regional liver unit, and 3 prisons. And we're very, very keen to make sure that the prison populations that fall within our geography are included in this project. These are our partners. You may not be able to see the detail, but right in the middle, that's Central Northwest London Addiction Services. We're the host organisation. But we've got a range of partners and collaborators. It includes the Hepatitis C Trust, the Northwest London Sexual Health Network, Health Protection Agency for the time it's around, NHS London, Imperial College are providing us with academic support, and then we've got the 2 acute trusts. So we've got Imperial College Healthcare, and we've got Chelsea and Westminster NHS Foundation Trust. And we all sit in a steering group and we're well represented and well engaged as a team. Where are the gaps? Well, this project is going to look at 3 gaps. The first gap is that all substance misusers should be offered testing and education for hepatitis B, C and HIV. The second gap is that all substance misusers should be offered vaccination against hepatitis B, where indicated. And the third gap is that there should be early referral to specialist hepatology and HIV services for engagement, assessment and treatment. So those are our 3 gaps. Now, just to show that visually, this is the front door of my clinic or of addiction services. All the patients who come through should receive a test for blood-borne virus. So everybody who walks through the door, whether they're taking drugs or whether they're taking alcohol, they should all be screened. A proportion of those patients will be appropriate for hepatitis B vaccination. And another smaller proportion still will have existing hepatitis or HIV and will need early referral to specialist services. Gap 1, Gap 2, Gap 3. Everybody clear on that? Yeah? These are our primary outcomes. We've been ambitious. We set ourselves a target of 100% for all of these 3 gaps, so to properly close these gaps. The current performance nationally for offering BBV testing is about 40 to 60% in substance misuse services. For offering hepatitis vaccination, about 60%, but only half of the people who are offered and accept it actually complete the course of the vaccine. And then there's no data at all nationally on the pathway between substance misuse services and specialist services, both HIV and hepatology. So we know what we should be doing. The question is how to do it. And one of the unique things about this project is that we started off on the premise that we couldn't decide anything without asking the patients. That actually the patients would have a lot better idea of what the problems in the system would be than actually we might. So the sort of questions we wanted to ask the patients were, what are the barriers to treatment? Are there different barriers for different groups? How would patients like BBV services to run within addictions? And so what we've done is we've embarked on a process of trying to collect this information. We've done it in a few different ways, but the main way is setting up 8 focus groups. And these are exploring the barriers to testing, vaccination and referral. And we've tried to make this group representative. So we have an inner London group, an outer London group, have a women's only group, have a homeless hostel group, have a group that's set in a prison. So we've tried to capture different experiences.